our first speaker, Dr. Ganesh Kumar Rai, to speak to us on bringing children back to school. And I'm sure all the countries in the region are struggling with this. We have had some progress in Sri Lanka, but we'd like to hear from the experience of other countries. Thank you. Dr. Ganesh Kumar Rai.
Thank you, sir. Is it my slides are visible, sir?
Sorry, your slides are visible. Yes, you can go on to slideshow. Yes.
And
Thank you.
I'm also audible.
Yes, you are audible. Thank you.
Thank you, sir. I have been given very sensitive and pertinent topic, bringing children back to school. Before I go to my slides, I would like to express my gratitude to the organizer and respected chair, co-chair, distinguished government officials, and distinguished guests. Let me share my slides. This is the newspaper published 3 days back, one of the popular English newspaper in Nepal. And also it talks about the schools reopening and calls for the assessment of learning outcomes. And this is the picture taken 1 year back in the school, how students attended the school. The staff there is just sanitizing the students. And this another picture where the students are sitting in the exams in the playground outside the school. Before I go to my topic, I would like to just recapitulate 4 rights of children based on the UN declaration. The first right is to basic needs like nutrition, adequate clothing, sufficient shelter, and health care. If we talk about basic needs, meals are given to the students usually in the government school in the unprivileged and communities, and that has been deprived of. Likewise, the healthcare like routine immunization, medicines for HIV/AIDS, vitamin A supplementation, deworming, treatment for chronic conditions, and routine surgeries have been stopped. As far as the right to play and recreation is concerned, the playgrounds are closed, children are confined at home. Therefore, this right is also deprived of. Likewise, the third one says the right to be protected from danger. During this pandemic, we all know the mental illness have increased, and child abuses are also increased in different forms. And as far as the right to education is concerned, which is topic now, this pandemic has affected education a lot. As we all know, information and communication technology is not accessible for most of the students, usually in our part of the world. And students could not learn from friends because besides the teachers, they learn from their friends as well. Therefore, online learning never can substitute school learning. The school closure affected every child globally. Let me come to today's topic. Let me just recapitulate the simple benefits we observe in the school learning. School learning helps to break the cycle of poverty. It also provides protection from harmful practices like early marriages, pregnancies, abuse at home. And also it ensures daily nutritious meal in the government schools. And students become capable of learning from their friends as well. And for some working parents, schools are affordable, reliable childcare center. Therefore, UNICEF said, when containment measures are being discussed and agreed upon, school must be the last to close and first to open. Now, how did the pandemic affect the education? Almost 90% of the students were affected by pandemic. and it is one of the largest disruption in the history of formal education. We all know educational opportunities have been unequally distributed by age, by genders, by income groups, by geographies, and other demographics. And these inequalities have been exacerbated by this pandemic. We all know about 20% of the children, adolescents, and youth globally were out of the school even before the pandemic. Therefore, the deputy regional director for South and East Africa said all governments should prioritize education and open the schools, and that schools should remain open and safe. As far as Nepal concerned, there is no exception. Almost more than 7 million students were affected. And according to the economic survey by the Minister of Finance in Nepal, only 12% of the schools have access to information and communication technology based learning. And during pandemic, there is an NGO called Open Learning Exchange. Just for example, distributed computers, interactive lecture softwares, and they gave the training to the teachers, and also in coordination with the Ministry of Education, Science and Technology, through their online education portal, they help free and open access for all learners. But this was not enough, especially for students who stay or who live in far mountains, or let's say far from the city. It is said that we have to measure the learning loss, or we have to evaluate the impact of pandemic on learning outcomes, which is the critical steps to mitigate the consequences of any pandemic. But unfortunately, only 1/3 of countries are taking steps to measure those learning losses in the primary and secondary levels, mostly in high-income developed countries. And the director of UNESCO Institute for Statistics said, countries should invest in assessing the magnitude of such learning losses to implement the appropriate remedy measures. World Bank has observed and said that 1 in 3 countries are not taking action to help students catch up on their learning during this COVID school closures. The CDC said schools are not as responsible for outbreaks as nursing homes, correctional facilities, and high-density work sites like meat packing places. Therefore, schools should be reopened as soon as possible. However, we have to maintain the physical distancing, we have to wear the masks, and there should be framework and guidance in place for local authorities, school administrators, parents, etc. UNICEF further says government should urgently need further invest in meeting the condition to keep schools open, like simple measures like safe availability of masks. They have to ensure sufficient ventilation, and there should be sufficient desks and chairs so that physical distancing can be maintained. And there should be enough water and hygiene facilities in the school, and they should ensure resources to support catch up on learning loss. And they also have to build that better system to withstand future shocks, and also prioritize teachers for vaccination. And as I have already said, there is little evidence that schools have contributed to increased community transmission of COVID-19. If the school close, that will affect on students' academic progress, as mental health discussed by previous speaker, and of course, as mentioned earlier, access to essential services. However, schools should limit activities that could increase the risk of transmission, like indoor sports and other competitions. And CDC also advises so-called hybrid approach, that is combination of in-person as well as online learning, that will avoid the crowding in classrooms. And we have to expand our testing so that every teacher or students who get infected can be quickly identified and isolated. National Academics of Science, Engineering, and Medicine, USA, recommends research on 4 areas that will fill the gaps in the evidence of transmission or spread of COVID. That is the role of children in transmission of COVID, role of reopening schools in the spread of COVID in communities, role of airborne transmission of COVID-19, and relative effectiveness of different mitigation strategies in the school. The same National Academics of Science, Engineering, and Medicine recommends high priority mitigation strategies to be in place. They are mask wearing, hand hygiene, physical distancing, and limiting large gatherings. There are other measures like cleaning the rooms, ventilation in the room, and air filtrations are also important, but they do not work like mask wearing, hand hygiene, physical distancing, etc. And they also advocate to create a small cohorts of students, which is a promising strategy to open the school. Therefore, based on those facts I mentioned, perhaps this forum is the right forum to recommend framework and guidance should be in place for local authorities, schools, and parents. We have to prioritize mask wearing, hand hygiene, physical distancing, and we have to limit the large gatherings like indoor activities, games, competition, etc. The school and rooms should be clean, ventilated, and if available, air filtration should be there in place. The school can create a small cohort of students, which is supposed to be promising strategy to open the school, and hybrid approach like online plus in-school learning. Local governments, public health authorities, and schools should have clear plan and coordination among them to implement the mitigation strategies. There should be provision of testing, isolation, and treatment facilities in the local levels. There should be provision of adequate toilets and water supply in the school. And there should be vaccination of all teachers and school staff, as well as being pediatricians. We have to advocate for vaccination of students above 5 years. And for all these issues, central governments should play the leading role. Having been said that, even if all the mitigation strategies are in place and well implemented, it is very difficult to completely eliminate the risks of COVID in schools. Therefore, perhaps we have to adapt to live with COVID-19. Thank you, sir.
Yeah, thank you very much for that excellent lecture. Taking one sentence from that lecture is that right-based approach. Children have the right to education, right for health, and all governments should prioritize bringing children back to school, and school should be remain open and should be supported.